Welcome back to Therani. I'm Joe B. Are you tired of opening your patient's physical therapy treatment chart and not knowing how they did the last session, as well as the direction of care? If so, then this video will show you how to write a treatment note that tracks so you're always in the know. Let's dive in. The first thing to consider when writing a subjective objective assessment plan note or SOAP note that tracks is that you need to know the aspects of the SOAP note that will auto-populate to the next one. For example, if you are using an electronic documentation software, for instance WebPT, whatever you place on the subjective current complaints, objective CPT codes, assessment, plan, and precautions will all auto-populate to the next note. Because of this, you need to make sure you place all the information you want to carry over onto the next visit to those 5 areas. Let us discuss what are the pertinent information that need to be placed under the subjective current complaints. First, the next medical doctor follow-up appointment should be placed on top. By placing this on this subjective complaint, it allows the next therapist to know when to do a progress report that can be sent to the referring medical doctor, since sometimes the patient's follow-up with the doctor does not always line up to their 10th session, where they are supposed to have a progress report. Second, the functional limitations or impairments identified during the initial evaluation needs to be at the bottom of the subjective current complaints. This allows the treating therapist following the evaluating therapist to be reminded what functional limitations we need to provide exercises and simulated activities for. In addition, when the time comes for a progress report or a recertification, then you could just highlight and copy the functional limitations identified during the initial evaluation, paste it on top, and then edit it to include your patient's current functional gains since the PT sessions began. The date of surgery can also be placed here. Finally, the date as well as the patient's subjective complaints each session needs to be included. This enables you to track the evolution of your patient's symptomatic and functional progress. It also allows you to continue asking the pertinent questions and address the main problems that brought them to physical therapy in the first place. Now let us delve into the pertinent information that need to be placed under the objective CPT codes. Any quantitative measurements taken during the session can all be placed on the objective findings. In terms of the exercises/activities, please select the appropriate CPT code and write them in such a way that all supine, side-lying, prone exercises are done first, then the sitting exercise, then the standing exercises, or vice versa. This is called a position-based exercise ordering. This will improve your efficiency each session. Because some exercises can go under the therapeutic exercises, therapeutic activities, or neuromuscular reeducation, writing a rationale above your list of exercise under the therapeutic activities and neuromuscular reeducation can fortify your justification. Do not forget to write the time above each CPT codes, adhering to the 8-minute rule, and total it. Finally, exercises that need to be archived can be done by creating a not today list. This will allow other therapists to avoid providing the same exercises repeatedly. For the assessment part, first include the patient's response to interventions, including exercises that were the most challenging to the patient, as well as the cueing required to ensure proper form for those tasks. Second, document any progress or lack thereof from the exercises and ways to achieve those progress next session. Third, write any family, patient, or provider communication to ensure home exercise program or durable medical equipment compliance. For the plan, please indicate any exercise suggestions for future sessions, including the specific parameters. You can also indicate any home exercise program, physical therapy supplies, or durable medical equipments or DMEs that are yet to be provided to improve patient outcomes. Finally, any endorsements to the next therapists regarding family, patient, or referring provider communication should be indicated for better care continuity. For the precautions, you can write there if your patient is a fall risk. You can also write any information in the past medical history that makes the patient contraindicated to certain physical therapy interventions. Do you want to learn how to write progress reports that referring providers love? If so, then watch this next video. Thank you so much.